Dr. Stanczak here. We're going to talk about a herniated disc today. So I have my trusty spinal model, okay? And what we're looking at is bones, disc, and nerves. So let me take this top one off here. I'm going to pull the top bone off so we can really understand what we're looking at. So I'm going to turn it on end. Now this is looking at you from top down per se. So this is the disc. This is the spinal cord with the nerves that come out of the side and the bone on the bottom. Well, what happens is in a traumatic instance, the disc, if it receives a force that it's not designed to receive or it exceeds its capacity, the disc can actually herniate, or as you can see here, push, let me zoom in a little bit, push onto the nerve, okay? Whereas the normal disc pushes back over, wouldn't do so. As you can see here, a little red part that's pushing into the nerve. Now, that herniation can either go to one nerve or it can go directly in the center, put pressure directly on the cord, or on the opposite side. So usually if it's only on one side, you can have pain on that side, or you'll have deficits on that side, meaning you have loss of sensation, loss of motion in that hand. You can have pain down into that arm, pain down into that leg, even loss of function of the leg where it's very difficult to walk, or kind of dragging leg, things of that sort. So when we start to look at treating these, we have to understand the mechanism of injury. Now, if the mechanism of injury is a result of loss of motion from degeneration and you pick something up off the floor, well, then we would begin with manipulation and restoring the motion back to the joint the way that it should be. However, if this joint was a herniation as a result of some other high velocity traumatic instance, then we may start to look at other forms of treatment such as decompression in order to allow the spine to open like an accordion. When it opens like an accordion, it causes a negative decompressive effect within the disc. So essentially it's going to pull the disc open and it's going to stretch it, causing a vacuum effect to pull the nutrients back into the disc to allow it to start healing correctly.